Back pain. It is something we all experience. In this and next week's video, I'm going to be sharing some simple tips that you can use to take care of your lower back, to reduce the pressure on it, and hopefully help avoid more lower back pain in the future. Hi, I'm Catherine. I'm the founder and principal therapist of Layton Sports Massage, or LSM Clinic. In this video, In this channel, I share information about how the body works and simple self-care tips to help you stay as close to pain-free as possible. Now, lower back pain is tricky, and it's why I'm separating the back into lower back and upper back in these two videos, because lower back pain, the lower back is 5 vertebrae and has no other skeletal support. Because of that, because we have the ribs supporting the upper back and the middle back, and we have the pelvis supporting the hips, often our lower back pain can come from all over the body. It's very rare that when we have lower back that we have, that it comes directly from the lower back. So if I were to go into all the things that you can do to take care of your lower back, it would be a really long video because basically almost everything in your body can have an impact on your lower back. What I've done is I've chosen 4 really easy things that should be fairly simple to fit into your day-to-day life that are going to help reduce the pressure on your lower back, and then a stretch to help you release it. So the first thing that you want to do when you're working on your lower back is to activate your lower abdominals. One of the most common reasons that the lower back gets achy and tight is because it's carrying the full load of the lower part of the torso on its own. The way that our body is made is that we are supposed to be getting support all the way around the lower half of the torso, from our abdominals and from our back, and then also our glutes and our diaphragm and our pelvic floor all play a part as well. But what will often happen is that our abdominals kind of start to switch off after a certain point, and there are a lot of different possible reasons that this can happen. But once your lower abdominals are switched off, then your lower back is basically carrying around everything in that middle part of your body. So the first tip I have for you is to get in the habit of activating your lower abdominals and using them to support your body throughout the day. Now, just a note, if you have had a baby and you have diastasis recti, which is a separation in the abdominal muscles, you probably want to check with someone before you start doing this tip. It's generally very safe and shouldn't create any problem, but as with everything, if at any point with any of these tips, you experience any pain or discomfort, just stop doing it until you can have someone look at you and see what's going on. So with the activating the lower abdominals, basically what you want to do is you want to imagine that you're sucking your belly button into your back, but you only want to do it with a 10% contraction. So what does that mean, a 10% contraction? If you were to suck your belly button into the back of your body as strong as you possibly could, that would be 100% contraction. So activating your abdominals so that they come in just a little bit, you want about 1/10 of that force, so about 10%. The reason that we only want to do 10% is because we want to connect with your postural muscles. We want your body to get used to your lower abdominals supporting you, and we want it to kind of become more normal, right? So that they start to switch on. One way you can do that is if you just put your hands in your lower abdomen, which if you put your fingers underneath your belly button and between your hip bones and put your hands there. That is the part that you're trying to suck into your back, into your spine. And again, to get 10%, you can suck in as hard as you can, and that's 100%. And then you want to come out of it till it's about 10%. This is especially helpful when you're walking around or standing for long periods of time. And you can also use this activation to support your lower back when you're picking things up. Obviously, wherever possible, when you pick something up, you want to bend at the legs and not bend at the back. But sometimes we do have to bend with the back a little bit, and activating our abs can help doing that. If you have trouble getting your abs connected. Like sometimes people might feel just the upper abdominals instead of the lower ones. You can tap. So like about this much, right? We don't want to be banging it. And we also don't want to do it so light that it's barely touching. You just want to tap the muscles between the hip bones in the front and underneath the belly button. And that's going to make it easier for those abs to activate. This is something that you can do throughout your day. There are also some exercises that help you strengthen it, like the pelvic tilt and like a baby roll down, which we do have in our neck and shoulder pain course for desk workers. We have a couple of exercises for lower back in there as well. So I'll link to our course below if you're interested. Otherwise, just try and remember around your day to activate your abs and pull them in. So that's tip number 1. Tip number 2, stretching your hip flexors. So another thing that puts a lot of strain on the lower back is we have these muscles called the psoas, which is a hip flexor, and it attaches to the front of our spine in our lower back. When those muscles are tight, which they usually are if you sit around for long periods of time, they get used in walking, running, and cycling. So almost everybody has tight hip flexors because of these things. When they get tight, they pull the spine forward when you're standing up. And then as a result, your lower back has to pull against them to try and stop them from being pulled forward. So if you'd like more information about it, I do have a psoas video, which is psoas muscle of the month. So I'll link that in the description below. It gives you more information about the muscle and where it is and what it looks like so you can picture it. When you're stretching your hip flexors, you want to be gentle with it. A really easy way to stretch your hip flexors is to stand with your feet hip width apart and then put one of your feet back behind you. And then just pull the bottom of your pelvis up towards you just a little bit. And then you should feel a light stretch across the front of the hip on the back leg. This is something that we can go through with you in a session or in a workshop if you're interested. And if you'd like more information on that, just leave a comment below. Tip number 3. Stretching the piriformis. So another thing that happens a lot of the time for various reasons is that there are these small muscles in the back of the hip that get tight when we like walk around, run, cycle, just go about our day, right? They get tight likely because the glutes aren't activating, but that's another video. That's actually a whole other playlist. So one of the things that you can do to take pressure off of your lower back is to gently stretch the back of the hip. Now, these muscles are a little bit tricky because most of the time when you feel like you're stretching them, you've probably gone a little bit too far. So a really easy way to stretch the piriformis, and there's a bit more information about the piriformis in one of our videos, Muscle of the Month Piriformis, which I will link in the description below. And all you have to do to stretch it is if you sit with your feet flat on the floor, and you take, let's say you're stretching the left side, you take your left foot and put it on your right knee. So you're in like a figure 4, and then you just sit up straight. You don't need to bend forward, but just sit up straight and breathe into the back of the hip that you're trying to stretch. And that should go a long ways to start taking pressure off of your lower back. And fun fact, stretching your piriformis gently like that sometimes helps with neck rotation as well. So that's number 3, which is stretch the back of the hips. Tip number 4, we're on the last one now. Now, everything that I've given you up to this point is something to support your lower back to reduce the strain on it. So that should reduce the tension, but sometimes it's just nice to have a lower back stretch, right? So the last tip I have for you for taking care of your lower back is to do the child's pose stretch in yoga. One thing that I like to do, because often this can be too much for my clients, is you can put a pillow underneath your feet. So a foot and floor, there's a pillow. You can put a pillow between your hips and your feet, so there's space. I also really like taking like a few cushions if you have them and stacking them on top lengthways. So then you can lay down on them and you're kind of lifted up, and that gets you more of a stretch into the lower back. Now, again, if this causes any pain or discomfort in the lower back or the hips or the knees, don't do it. Trying those tips with pillows can often help to take the pressure off the areas that sometimes feel uncomfortable. So definitely try those. And if it feels comfortable, you can hold this stretch for, I don't know, 1 to 2 minutes and just breathe into your lower back. And that's something you can do kind of at the end of the day, right? Like before you go to bed, when you've been walking around all day, that just helps to open up the back and release it before you go to sleep. Okay, so just a quick recap of the 4 tips. Number 1, activate your lower abdominals when you stand and bend over. That helps to protect your lower back and reduce the strain it feels. Number 2, gently stretch your hip flexors. That reduces the pull on the front of the body and thereby reducing the pull on the lower back. Number 3, gently stretch the back of the hip, which is a muscle called piriformis, which again, you can find out more in our piriformis video. And number 4, you can do a gentle child's pose to open up your lower back. Our lower back does so much for us on a day-to-day basis in the way that it kind of holds us together. And it's so easy for it to get injured because of the structure that it has. So hopefully these tips can help. And I will see you next week for our